Hello, everyone. Welcome to Side Event 6, the role of behavioral science in the delivery of social protection cash transfers in the era of COVID-19 and beyond. This session is part of the conference, Turning the COVID-19 Crisis into an Opportunity. What's next for social protection? The e-conference has been developed as a virtual live space for learning, interaction, collaboration, and knowledge sharing on social protection, leveraging the COVID-19 crisis into an opportunity to build stronger and more efficient policies. Please make sure to join us on other sessions through October 8th. My name is Jessica Jean-Francois. I am Vice President at Ideas 42. A quick background on Ideas 42. At Ideas 42, we believe that a deep understanding of human behavior will help us improve millions of lives. For more than a decade, we've been at the forefront of applying behavioral science in the real world. We create innovative solutions to tough problems, ultimately striving to generate lasting impact and create a future where the universal application of behavioral science powers a world with optimal health, equitable wealth, and environments and systems that are sustainable and just for all. Our efforts have so far extended to 40 countries as we've partnered with governments, foundations, NGOs, private enterprises, and a wide array of public institutions. Today, I am joined by colleagues and partners who are working with Ideas 42 to optimize the delivery and design of cash transfers through the application of behavioral science. As you're probably well aware, since March 2020, 139 countries and territories have planned, implemented, and adapted cash transfers to support their populations as they navigate the challenges produced as a result of the coronavirus pandemic. Such programs can offer important forms of relief at a time when many people are likely to experience adverse changes to their income and employment. The relief includes a rapid and cost-effective way to provide basic needs like food and shelter in the midst of the emergency, a means to recover and rebuild after the crisis, and protection from future shocks. With limited funding available, it is crucial that cash transfers programs are designed or redesigned thoughtfully so that governments and recipients can make the most of the resources available. Our panelists today have a long history with applying behavioral science to social protection cash transfers from the government perspective, from the World Bank perspective, and the Ideas 42 perspective. Our panelists will each have 10 minutes to share thoughts on the subject. Once all the panelists have spoken, we will spend 10 minutes on follow-up questions from me and then open it up for Q&A sessions with questions from the audience. So please send your questions by clicking the Q&A button at the bottom of your screen. So I'll now introduce the panelists. First, we have John Gashigi. John Gashigi is the Director of the Social Assistance Unit at the Kenya Ministry of Labor and Social Protection. His functions include the implementation of 3 consolidated cash transfers programs. So this includes coordination of targeting, enrollment, and recertification of beneficiaries, management of payment delivery systems, maintaining the management information system, coordinating grievances, change management, and coordination of the COVID-19 response fund through cash transfers. Mr. Gashigi has a wealth of knowledge and experience on social protection and has presented several times on this topic. Next, we have Laura B. Rawlings. Laura is a lead economist with the Human Capital Project at the World Bank. It's a global effort to accelerate more and better investment in people for greater equity and economic growth. She is responsible for the early years work on child development and for engagement with the Africa region. In her career, Laura has led numerous projects and research initiatives in the area of cash transfers, public works, social funds, early childhood development, behavioral interventions, and social protection systems. She was the team leader for the Africa Human Capital Project, the World Bank Social Protection and Labor Strategy from 2012 to 2022, manager of the Strategic Impact Evaluation Fund, and sector leader of the Human Development in Central Africa. She has also published numerous books and articles in the fields of evaluation and human development, including impact evaluation and practice. Last, we have Sragato Dada. Sragato Dada is a managing director at Ideas 42. He oversees work on application of behavioral science in low and middle income countries in South and Southeast Asia and Sub-Saharan Africa in partnership with government agencies, multilateral organizations, NGOs, and firms focused on low income populations. His current work spans violence reduction, bureaucratic behavior, education, labor markets, agriculture, cash transfers, and social protection programs. He also worked on behavioral interventions in public health and around resource conservation. So a warm welcome to the panelists, and thank you so much for being here to share your experience. So I'll now pass it over to Mr. Gashigi. Mr. Gashigi, can you please share some updates about the Kenya government-led social protection cash transfers programs? What has the implementation of cash transfers looked like during the COVID-19 pandemic? What has changed?
So good afternoon, participants. I'm happy to join this meeting so that I can share the Kenyan situation and how we have responded to the COVID-19. The Kenya government and its partners have been keen to respond to the current situation for the beneficiaries, particularly as a result of the effect of the COVID. Beneficiaries were already vulnerable before the COVID arrived. That's why we had already targeted them. But the advent of the COVID made the situation to be even more worse and more difficult. And as a result, therefore, it has really impacted on all the families. For instance, it has increased the expenses at home, whereby now children do not go to school and they have to be fed all the day long, despite the fact that parents had paid their school fees. And then there's increased expenses due to the increase in the food prices, because even farming activities have been lowered and then the demand for food is high. So there's a lot of the expenses in terms of food are very high. And then there's decrease in income because most of the people, they tended to go out and do some small scale businesses. Others were doing other remedial jobs. And also some of them have been declared redundant. And therefore there is a decrease in income, and also the businesses are also not doing well. And also there is also the lack of affordability of the necessary masks, sanitizers when going out. So because of those ones, you find that people are normally recycling the masks, and then sometimes they are not even using the sanitizers. And then the coronavirus now has made it even very difficult for life. However, the government together with some development partners have made some interventions. Some of those interventions which the government has made are such that we normally have the normal cash transfer programs which the government implements. Our programs, the three cash transfer programs, we were able to pay all the beneficiaries for the 8 months. That is between January and August this year. We were able to pay 1,094,000 beneficiaries. And within that period, we were able to pay to the tune of about $175 million US. And we believe that this money really went into supporting the beneficiaries so that they can be able so as to be cautioned from the effect of the COVID. Other than this, the government also set aside a special fund to support the new vulnerables as a result of the COVID. On this one, the government allocated the $100 million US, and this is the money which is given out to the new vulnerables on a weekly basis, and it's a stipend which is paid through the mobile platform. And as today, the people who are on the payroll are 333,200 households who are now getting this monthly stipend, weekly stipend. Then the government has also established another economic stimulus program worth $10 million US to support 90,000 vulnerables. This economic stimulus is to support them so that they can be able now to purchase items in their shops and also start income generating activities and also buy farm activities. And this is a one-off package they are getting. And that way it's going also to spur the economy, because even the business people will get money to support them. And then we have got our partners who are also supporting us in this activity. For instance, we have one of the banks, the biggest bank in Kenya called the Kenya Commercial Bank. They have come up with a program where they want to avert the shocks, whereby they are supporting 1,000 Inua Jamii beneficiaries. So they are giving top up to the existing beneficiaries. And that money is also supposed to be to support them to buy products, and whereby they are giving like the e-vouchers, and the beneficiaries now are able now to go to a shop, a designated shop, and then they buy products. We also have got other partners like the UNICEF, whereby they have also come up with a program whereby they are doing the vertical expansion of the already existing program. And they are targeting 8,000 beneficiaries. And these beneficiaries, they're also getting a monthly stipend. And the current budget they're having is $4.1 million US. And then the World Food Program, they also have come up with a program called the Urban Food Assistance Program. It is targeting 750 households in the informal settlements. Currently, they are working in Nairobi, but very soon they are moving to other urban setup. The money they are spending, the current budget is about 110 million US. And this is money which is also given to the beneficiaries on monthly basis. The unique thing about the World Food Program is that they are targeting the new vulnerables, especially those households with children who are malnourished. So they are covering them. And then also households with persons with the HIV/AIDS. And those ones, the HIV/AIDS, maybe they have been getting support from other sources. But because of the COVID, they are not able maybe to get all the support they were getting. So now the World Food Program now, STIMPED is now able now to ensure that they are properly cautioned. And then the government has also another program which is now targeting the persons with the disability. The persons with the disability program, they came up with a fund which is to a tune of about $2 million US. And this was to caution about 3,333 persons with disabilities. These ones, they were given a one-off cash for 4 months. And that money was able now to support them to do other related activities. So basically, we can say that the government has really responded to the COVID with the support of partners and other people. What has changed is that because of the COVID, the new vulnerables whom we have been able now to target, we did not use the normal method we use for the targeting. Instead, we use the multi-agency approach for enhanced transparency, whereby we used the structures which exist at the lowest level, at the village level, whereby the village, the elders were the ones now who are targeting the beneficiary because they know them better. And that way we were able now to reduce cases of complaints and grievances. The other thing which has also changed is that we have been able to digitalize the registration process and the validation through existing data, the existing databases for improved accuracy, interoperability of the data, and also the data validation. What I mean here is that all the data we collected for the new variables, we were able now to validate it using like the current beneficiaries so that we don't do the double dipping, and also other government to ensure that people are not cheating and the records which they are giving us, they are the correct records. And then there has also been the establishment of an interministerial working group for all the government and government organizations so that we can do a harmonious work and we avoid the duplication of efforts, and also we share the experiences. So those are some of the methods, the way we have changed things. In terms of the delivery mechanism, initially we used to pay beneficiaries using the bank account. But now with the advent of the COVID now, we have now expanded the delivery mechanism, and now we have now introduced the mobile money platform whereby the beneficiaries now are getting the money using the mobile phones. And this one, it is a bit faster, it is timely, it is predictable and cost effective. For the beneficiaries who are getting money on a weekly basis, every Tuesday, that's when they are getting the money through the mobile phone. And therefore, they are able even to plan on how to do with that money. And then the weekly payment has also provided beneficiaries with regular income for basic consumption. Because the money is coming regularly, they are able now to buy foods, go for medical for medical needs and also do other things. They can even borrow because they are sure that that money is coming within the required period. The other thing we did is that for our regular beneficiaries, all the payment we have done, we had to take into consideration that we needed to protect them from contracting COVID. As a result, therefore, we sat down with the banks and other stakeholders, and we developed some payment guidance and hygiene protocols to ensure that all our beneficiaries adhere to the guidelines and the protocols given by the Ministry of Health. And therefore, we ensured that none of our beneficiaries got contracted during the period when they were getting the money. The other thing this COVID has taught us is that we have got now a new crop of vulnerables who were not there before. And these are the vulnerables who either they are household-headed households, they are the breadwinners of the household, but in one way or another, they are disabled. Others, they are widowed. Others, they are orphans or child-headed households. Others are chronically sick. Then we have got those ones who are mentally unsound. We have got the casual laborers who lost their jobs, and then the small-scale businesses who also lost their businesses. So this is a completely new category of the new vulnerables who are not there before the COVID, but through the various interventions we are doing, we have been able to bring them on board. Finally, some of the challenges we have encountered during the implementation of these COVID interventions is that most of the beneficiaries have depleted both the resources and the savings through the consumptions. We had started a program with Ideas 42 on encouraging the beneficiaries to do some savings. And most of them had done some savings for almost 1 year. And the reason why they wanted to do that saving so that they can use that money to start income generating activities. But as a result of the COVID now, they have now depleted all those savings, meaning that we have to go back to square one. And then the fear of the contracting coronavirus is due to being at the risky group. Especially most of our beneficiaries are those ones who are 70 years and above. And because it is always said that they are the ones which are very risky, it has now made them to stay indoors. They are not even venturing out. They are not even going to visit friends. They are not doing other activities because of that fear that they might contract. Some are even refusing to accept their children when they come to visit them or other visitors. So that fear of the unknown is also very, very, very high. And finally, the medical facilities have not been very much accessible to our beneficiaries because maybe sometimes they have to ride on motorbikes, they have to go with the vehicle, and they're also fearing that if they ride on motorbikes or to board vehicles and also go to those hospitals to do the queuing, they might also contract. So those are some of the challenges we are encountering, but to the best of our ability, we are trying as much as possible to support both the old beneficiaries, the new vulnerables, and also those others who are not part of our support group. Thank you, and over.
Thank you so much, Mr. Gashigi, for this very thorough overview of the current situation in Kenya. I think we can learn a lot from that. Now I'll move it over to Laura. Laura, maybe you can share with us some insights on the social protection policy updates at the World Bank due to COVID-19. How have social protection policies shifted, and what is the role in behavioral science in the overall response?
Thank you so much, Jessica, and thank you, Mr. Gachigi, for your interventions and to let us know what is happening in Kenya. I wanted to take this opportunity to answer Jessica's question and talk about really three things around the evolution of social protection and the strong behavioral elements that have been at the core of much of the social protection work since its earliest days. So I first want to talk about the behavioral foundations of social protection. Second, about the COVID crisis and how we're responding and the behavioral elements therein. And then I'd like to end with just a few thoughts on the opportunities looking ahead and the future direction for social protection and related behavioral work. So starting with the first part about the behavioral foundations of social protection. At its heart, this is socialprotection.org. We are all practitioners are very interested in this field. And we know that at its heart, social protection is about how people and societies manage risk, either individually or collectively, and are focused on building particularly resilience for the vulnerable. So that's often through social insurance and through insuring against the impacts of different types of shocks, through a focus on equity, protecting the poor and against dire losses of human capital and against extreme poverty, which is often the domain of social assistance, and then looking at promoting opportunity. And that is often around investments with a longer term view, so investments in human capital and investments in the productive potential of people. So these areas of risk management around resilience, equity, and opportunity, often referred to also as prevention, protection, and promotion, are really at the heart of social protection work and of working with people, as I was saying, either through individual choices or through collective endeavors to implement risk management. And there are some fairly famous examples in social protection of how behavioral interventions have come in, everything from stronger design around norms to lighter touch nudges. So one of the most famous ones, at least in my country in the United States, was a reform that was introduced in 2006 in the US pension system that inspired a lot by Nobel Prize winner Richard Thaler's work, where instead of people choosing to set money aside for retirement, the default option was to set aside a portion of workers' earnings for retirement and then give individuals the option to opt out. And this raised pension participation rates from 42% to 91% in over a period of time. So that's a famous example, but I think a powerful one in the social protection area. In the area of cash transfers, which is what I think many of us are interested in today, and certainly the focus of today's session, there has also been a strong behavioral foundation in the work. And that really started with some of the first large-scale conditional cash transfer programs, particularly in Latin America, where there was an emphasis on co-responsibilities particularly with parents. So the idea was that they would receive, of course, the cash transfers, but the agreement was that they would engage in certain behaviors, particularly with respect to safeguarding and investing in their children's human capital. So going to health clinics on a regular basis, ensuring school enrollment, attending sessions about well child care. And the premise and the promise of cash transfers has always been that there is short-term income support really for consumption smoothing and often targeted at groups that most need it, and long-term poverty reduction because of investments in human capital, in skills, in children's capacities, so that there can be longer-term impacts on poverty. And so all of these, both the short-term consumption smoothing and the long-term investments, of course, rely on people being informed and the recipients making informed and deliberate choices. So as this cash transfer work has evolved and beyond these initial models in Latin America around conditional cash transfers, there's been a real explosion in these programs across the world. And they are now present in all regions and many, many countries, as we'll see in just a moment. But this idea of having both the short-term consumption smoothing and the longer-term investments is still very much at the core of the work. And the behavioral designs have evolved to accompany this. And so the whole Cash Plus agenda, or the work on accompanying measures, is very much informed by behavioral insights. And this is a lot of the work that we at the World Bank have been doing in partnership with Ideas 42 in 11 countries in sub-Saharan Africa, including in Kenya. And a lot of the work is designed to really address some of the behavioral barriers that can often be there around mental models and perceptions, taking into account also people's cognitive bandwidth and the choices that they are making in the here and now with the pressures of the scarcity of poverty. Addressing also myopia and often this present bias that people have of thinking about things in the here and now and not necessarily in the future, and also taking into account norms and conformity that can go along with certain social norms. So we have been working, and it's not just us, it is of course happening all over the world, but really in a lot of areas for investing in human capital. So investing in children, investing in education, investing in health, and also trying to ensure productive inclusion. So Mr. Gachigi was mentioning the importance of savings, and that being accompanied by a plan to look forward and boost income and enhance productivity. So these two areas really of working with behaviorally designed accompanying measures to boost human capital and to enhance productive inclusion have been two very strong lines of work. Now moving on to the second part of my intervention about the COVID crisis. And here maybe we'll turn to the one slide that I wanted to put up. And simply to say that the COVID crisis, as we're all aware, is the crisis of our lifetimes. We hope there will not be a worse one, but it is one that threatens hard-won human capital gains. As Mr. Gachigi mentioned, schools have closed, health systems are under strain, social protection systems are under strain. The ILO estimates that over 400 million full-time equivalent jobs have been lost, that nearly half of the global workforce is at risk, their livelihoods are at risk. And the World Bank estimates that up to 100 million additional people are projected to fall into poverty. So this is a crisis of historic dimensions that calls on responses, and responses have been multifaceted, of course, on the health response, but also social protection has really stepped up as a sector and as a type of response that has become highly relevant during the COVID crisis, because again, this is about risk management, and social protection measures have really stepped up to help countries, communities, and individuals manage the social and economic risks of COVID-19. So what have we seen? We've seen a very, as you see on the slide, we've seen a very rapid expansion in social protection responses to COVID-19. And since March of this year, the number of countries with social protection programs has quadrupled. So there are now 195 countries that have these programs in place. And the number of social protection measures has increased tenfold, and they're now over 1,000 in terms of those particular measures or programs. And this has been characterized primarily by either a of vertical expansion, that is to say top-ups in the types of benefits or the level of benefits provided to existing beneficiaries who are under additional strain because of COVID-19. And we've also seen horizontal expansion where new measures, new programs, and most importantly, new populations have come to benefit from an expansion. And at its heart, the primary response has been cash transfers. That's to say social safety nets providing income support to particular groups. And the big advent here has really been in reaching, as Mr. Gachigi was mentioning, the new vulnerable, who are often people who have lost their jobs, people who are often in the informal sector and did not have access to any kind of formal work-related type of social insurance, right? Unemployment insurance, particularly. So this is the new frontier in a lot of countries, is working in these urban areas, providing cash transfers to largely informal workers. So let me close with the third part of my intervention, which is really about looking ahead and looking toward the future. We've seen with the COVID-19 crisis an extraordinary response and extraordinary flexibility in terms of using social protection and to respond to this global crisis, to reach the newly vulnerable, to work with populations and in areas where the programs have not been present before, and it has required a great deal of financing, of ingenuity and innovation, and also has been quite informed and needs to continue to be informed by behavioral insights, so that we can not only address these immediate needs, but really look to build also opportunities for people and for social protection systems to be in a better place in terms of risk management approaches in the future. And the need is great, both to respond to COVID, and even because we know that even prior to the COVID crisis, less than half of the global population has access to any kind of social protection, and that drops to only 19% of people in the poorest quintile. So what you often have is often characterized as a problem of the missing middle. You have people who have access often to social insurance through their work and through formal sector employment, who tend to be higher income individuals. You have poverty targeted, on the other end, poverty targeted social protection programs, often cash transfers that are non-contributory and that are often targeted to some of the poorest and most vulnerable, and traditionally have been targeted to low income, often rural households, often with young children. And so you have a rather large missing middle of primarily urban, often informal sector workers who don't have access to the social insurance through formal sector jobs, but that often don't have the characteristics of the populations that are targeted through these predominantly rural and family-focused cash transfers. And these are a lot of the people that these programs are coming into contact with today. And the opportunity is that the response is not just a short-term response to help people during the COVID crisis, but really opens the opportunity to expand social protection to this missing middle and these uncovered groups. And I think we are supported in all of this by the recognition that it's important to have these services available. That's the big lesson from COVID. And the political will and consensus that universal social protection is a very important objective to which communities and countries and the international community aspires to. And there are very important entry points to take advantage of to expand social protection coverage, where behavioral insights are quite important. And we've been discussing a lot of these recently amongst ourselves, including with our colleagues at Ideas 42, about this frontier. And the frontier will rely on, first of all, honoring some of the strong traditions around co-responsibilities, around addressing information asymmetries, around working particularly with beneficiaries to make informed choices about the use of the cash, about productive inclusion, and about investing in human capital. It will also be informed by a very strong tradition in this field of having good evidence on what works and what doesn't, and what is cost effective. And that is a very attractive feature of behavioral interventions today, is that they often are very cost effective. And we know that part of what's happening with COVID-19 is that it is putting tremendous fiscal constraints on households as well as governments. There's also the promise of working to expand social protection through digital payments, and looking at the fact that as these e-payments evolve, again propelled by COVID, these delivery channels often allow for contact between beneficiaries and financial institutions. And this opens possibilities. It opens possibilities for accessing financial services, for accessing a broader range of risk management instruments. But it is also a world in which informed choices are very important. And going back to some of the things that we know from behavioral science about myopia, about norms, about the importance of being able to make informed choices, is really put at a premium, because there's a much broader range of options and opportunities, but there are also risks inherent in the misuse of those financial instruments as well. So,
Laura, if I can just jump in, I think maybe we have like 30 seconds and then we'll have to move it.
Perfect. Okay, then my concluding point. So where does this leave us? It leaves us with the importance of continuing to work both with beneficiaries, but also with providers, and looking at the importance of ensuring regularity in payments, this access to a wider range of services, but also continuing with the important traditions in the behavioral area that have been part of the history of social protection engagement. So I'll sign off there, and happy to answer any questions. Thank you so much.
Great. Thanks so much, Laura. And thanks for the reminder for everyone to put in your questions in the Q&A box. Shagato, can you comment on what the research on behavioral science can tell us about the recipient experience during this time? What are some barriers beneficiaries can be experiencing when it comes to accessing and using their cash during this time? And what design elements can policymakers and implementers take up to kind of preemptively address these barriers that might present themselves during this time?
Of course, and thank you everyone for participation, and thank you Laura and Mr. Gishigi for your excellent interventions, which really have helped us sort of set the stage in terms of the really dramatic response that country governments around the world, the international institutions have been part of in expanding access to a variety of forms of social protection, not least cash transfers during this COVID crisis. And so I think we've, through your two interventions, we've got a good sense of what's happening on the global scale, the scale of the response, as well as through Mr. Gishigi's intervention, I think a very good snapshot of the variety of ways in which a particular government, in this case Kenya, which I think is in many ways representative of many governments around the world in low and middle income countries, have been able to use social protection and cash transfers to buttress people's abilities to respond to and cope with this crisis, unprecedented as Laura, you said, well, certainly we hope not to be repeated in our lifetimes. And so I wanted to sort of zoom out a little bit and maybe just address the question that Jessica posed, building on what the previous interventions have shown us, which is that there is, as Laura was saying, there's a history of really thinking deeply about people's engagement with cash transfer programs as a fundamentally behavioral thing. So it's fundamentally about what people, how they engage with these programs, how they receive the cash, what they do with it. And as we've uncovered, and I think as the field has uncovered in our work with SAO and with the World Bank and with other partners in Sub-Saharan Africa, there are actually a number of ways in which bringing behavioral insights to bear on the way that recipients engage with transfer programs, with cash transfers, can be really helpful in allowing both the sorts of short-term consumption smoothing that Laura was talking about, as well as investments in human capital or in productive activities, which is the longer-term focus of many of these programs. And so what you see on the screen is something we at Ideas 42 have been working on closely with our colleagues at the World Bank, which is trying to put together what we know about the various ways in which behavioral science and behavioral insights can be informative for what's going on in cash transfers, and specifically focusing in this instance on the journey of the recipient as they navigate a cash transfer program. And you know, obviously we're not going to be able to go through all of these here, and we'd be happy to share these materials which take the form of some guidance to cash transfer program implementers, as well as a checklist of things that they can look at in thinking about the behavioral components. But let me pick up on maybe a couple of things that you see on this slide here, and actually on something that Laura said, which I think is very important, which is, and actually something that we also see from Mr. Geshige's intervention, which is that a lot of the people who are now being covered by cash transfer programs that have been set up either through a horizontal or a vertical expansion during COVID-19 are in fact people who are not sort of habitual beneficiaries, or they're not people who have been part of these programs before. So if we think about how the money that is provided through a cash transfer program is actually spent, we know from the work that we've been doing with our partners that so much depends on how people actually think about the program, what their mental models of what this cash is for is about. And that is where we see an enormous opportunity for implementers in the government and in the agencies that implement these programs to really frame these programs proactively in order to ensure that people are actually able to make the most of it. So to give you just a simple example, you know, when governments expand cash transfer programs to reach people perhaps who've lost their source of income, you know, they're in the informal sector, perhaps they're in some of the urban slums that Mr. Geshige was mentioning. These are not people who might have engaged with this program before, and some of these people might not have yet seen the full impact of the pandemic on their economic lives. And so it may be important for the program to help them very clearly see what this money is for, with what regularity or at what cadence they can expect to receive it, and help them actually think about what they're going to do with it, and ensure that they have, for instance, something set aside for the eventuality that some of these impacts that have not yet materialized in their specific cases do happen in the future, when there may not be additional cash support that is forthcoming depending on the nature of the program. So framing the program so that people really understand what the transfer is for and what they can do with it can be really helpful. And similarly, what we've seen, once people receive the cash, or when they're receiving the cash, is a really good opportunity also to reinforce some of this messaging, and also to give people some of the tools that they might need in order to make the plans and to set aside the funds or to budget in ways that are going to be important for them as they go through this crisis. I think all of us have now experienced the fact that one of the most sort of difficult things about something like COVID-19 is that we don't know when things are going to return to normal and what form that normal will take. And so managing this sort of persistent uncertainty is something that is very difficult even in normal times. And I think what we are seeing is that there is an opportunity for building behavioral interventions into the way programs are framed, into the way beneficiaries are engaged with, that are going to be really important for enhancing the impact of these programs. This also then means that there are a number of lessons from behavioral science for what program designers and implementers need to think about. So for instance, we've talked a little bit about targeting, which is, for example, one of Mr. Gishige's agency's key responsibilities in Kenya, but is also obviously an important part of how we identify cash transfer beneficiaries in any program. And here, it's important to take on board the literature from behavioral science, which shows us that even very small hassles in terms of the certain kinds of documentation that may need to be provided, or the modalities for engaging with cash transfer programs, can in fact end up deterring some of the people who it is most important to reach with these programs. And so when programs are being expanded, we have to think creatively about how to use existing identification mechanisms, how to use existing information that we might have, which might perhaps be a bit coarser than what is used in normal times, in order that we can really maximize the reach and impact and scope of these programs and get the money to the people who need it in the quickest time possible without incurring additional psychological hassles. And this also then affects what we do in terms of the modalities of actually coming and picking up the cash, which have to then be informed also, of course, by a variety of protocols that Mr. Gishige was referring to in terms of ensuring that people feel comfortable and feel safe in being able to actually pick up the cash, or that the cash is provided to them in ways that do not require contact. And I'd just like to wrap up really, and we'll be able to move on to questions hopefully, to say that one of the exciting things that this partnership that Laura mentioned, where we're working with so many country governments, has been able to do over the past few months is actually to go back to some of the beneficiaries of the Kenyan cash transfer program, the sort of the central cash transfer program that we were already working with whom we had already piloted a number of these behavioral interventions around plan making and budgeting. And with a small number of these beneficiaries, we were able to go back and actually ask them about how they had been coping during the COVID crisis. And I think what we learned was both sobering and heartening. So the sobering part is, of course, that 4 and 5 of the beneficiaries that we were able to speak to of this random sample of program beneficiaries said that they'd seen quite severe impacts on their economic circumstances because of COVID. So there were lost jobs, there were lost income opportunities, there were higher food prices, many of the things that Mr. Gishige mentioned. The heartening part is both that they certainly reported that the cash transfer payments that they were receiving were an important part of their coping strategy, but also that the ones who had been in the group that was exposed to behavioral interventions, even though those interventions at that time were not about, they were about budgeting or planning in general, they were not about coping with COVID, because this was being done before the crisis hit. They actually reported that they were using these interventions to actually help them manage the funds that they had coming in during the COVID crisis, enabling them to think a bit more about how they would recover and the kinds of activities that they would do to get themselves back to where they needed to be once the crisis was over. So that's just, it's a small study at this point, but I think what it underlines is some of the themes we've been talking about, which is that any program that we set up, we can make it much more impactful at relatively low cost. These are small, very, very low cost interventions that really help people manage their funds and manage their lives in times, both normal times and these unprecedented circumstances that they face currently. And that, so this enormous expansion in cash transfers and social protection could be made even more effective with an even more widespread application of behavioral science and behavioral interventions. So I'll stop there and hand it back to Jessica. But thank you so much for this opportunity to speak about these issues, which I think are really important.
Great, thank you so much, Sharato. Yeah, so I will transition us now into questions. And so I will actually, and please remember to put your questions into that Q&A button. So I'll actually start with a question for Mr. Gashigi, and also maybe Laura, you can comment here as well. So to what extent are the adaptations and changes to the cash transfers and social protection programs during the COVID-19 era, to what extent are they here to stay? And I'll couple that with another question from the audience where they also want to know, do you think that a universal basic income would at all be possible in the future?
So
Maybe
then
we can start.
Yes, the adaptations which we have already gone through, adapted during the COVID, most of them are there to stay. Number one, in terms of the use of the cash transfer, that one is going to stay, because even other humanitarian agencies who are using food products and also doing other, giving beneficiaries food vouchers and all those other things, they have changed and now they have adopted the cash transfer. And it has been proved that providing cash transfers is very, very effective because it gives beneficiaries the choice. Once you give the beneficiaries money, they're able to make a choice on what to buy and where to buy it, and maybe if they want to save and do other activities. So that's one thing which is not going to change. And then the other thing which is also not going to change is that we have already adopted payment of the beneficiaries using the mobile banking. Now we have now expanded our payment model where we are using the bank account or we are using cash on transit. Now with the money, paying the money through the mobile banking, it has also proved to be very, very effective. And I think that one is also not going to change. It's going to continue even for the more years to come. The other thing which is also not going to change is the issues to do with the doing the economic stimulus programs, whereby you give beneficiaries specific some money, and you tell them that money is to undertake a specific activity. For instance, is for the consumption, you give them like an e-voucher, and then that e-voucher, they go to a specific shop, and then now they buy food from that shop. The owner of the shop now will be able now to stock the shop, and then there's a spillover effect on what is going to happen. So that's also not going to change for in the future. And then the other thing which you have also introduced during this COVID is when it comes now to the targeting. Initially, we used to do scientific targeting using the Proximus test and also all those, and then you targeting through the system. But we have realized that because you only target those people who are in the program. But when it comes now to the new vulnerables, it is very difficult to target them in the system within the shortest time possible. And because you want to ensure that there's transparency, there's inclusiveness, and there's less complaints and grievances, now we have now used the multi-agency approach. And the multi-agency approach is whereby you are using many organizations, many entities at the grassroots level. And because they are the people who live with those vulnerables, they know them, they understand them. And therefore now, once now they target them, and then us now we put now that data in the various databases, and then we validate. Once we validate, we start giving them. So some of those adaptations, they are not going to change. They'll be for us for more days to come. Thank you.
Thank you so much. Laura, would you like to comment on that question?
Sure, I'd be happy to. And I thought Mr. Gachigi's answer was terrific in laying out the different areas where things have changed. I think that the only thing that I might add to that is what I was talking about before, is this work particularly with the urban informal sector and people who don't have access to formal sector social insurance, but have needed support. And I think that is an area, it's a very important group and one that needs to be included in terms of social protection approaches. And that's related to the second question about the possibility of a universal basic income. There's a book that I would recommend to you all on UBI that the World Bank has come out with that will have a much more thorough overview than I can give in just a moment. But essentially, a a lot of the policy options depend on country circumstances, and in certain countries, it may be possible to take a UBI approach, but the overarching objective should be full coverage of social protection. And there are many ways to achieve that. And often countries in a practical sense are going to work to fill in the gaps, if you will, given the systems that they already have in place. And to make sure that people have access to risk management instruments, be it through social insurance, be it through non-contributory cash transfers, or be it through, even market-based instruments that could be made accessible to the informal sector, but delinked from formal sector employment. So I think what's quite clear is that there's a goal toward universal social protection and to all people having access to risk management instruments. And whether or not that takes the form of a universal basic income will depend very much on country context. Thank you.
Thank you so much. I have one more question here, and maybe you all can comment on it. And I'll start with you, Shagato. So how are social protection programs ensuring that they're reaching the most vulnerable population? So we've heard a few comments about the new vulnerables, but there's also, target vulnerable populations for these type of programs. So what additional value does behavioral science provide in reaching those populations, especially in cases where parts of the process might be digitized?
Thanks, Jessica. I think that's an important question, as I think we were all alluding to in thinking about the potential for expansion of programs. And I think most programs, including the ones that Mr. Gishigi talked about, are confronting exactly this at the moment. They're trying to reach out to and include people who they've historically not been needed to sort of include in these programs. And I think in terms of what what behavioral science can bring to this is there is a large literature now of that really helps us understand that a lot of things that are normally considered to be important ways to target the right people and make sure that we don't essentially miss target programs have the side effect, the unintended consequence of actually excluding some of the most vulnerable. And so, I mentioned documentation requirements in my earlier intervention, and obviously the goal of any kind of documentation requirement is to ensure that we are in fact reaching people who need this assistance. But I think in country after country and in context after context, what we see is that they can in fact end up deterring some of the people who are most in need of assistance. Now, this of course does not mean that we abandon targeting. I think what it speaks to then is the need for being creative and flexible in how we target people and finding ways that do not impose additional cognitive or logistical burdens on intended beneficiaries for them to actually participate in these programs. And I think the other way in which behavioral science can be very important here is just thinking about existing beneficiary mindsets or mental models of government assistance, whether or not people consider themselves to be eligible for these programs. Again, thinking about people who have been put in a situation now, for instance, where they're having to rely on assistance or programs that they don't normally look to. Means that in addition to the sort of unfamiliarity with the way these programs work, there may be other bottlenecks in terms of people's mental models, about people's attitudes towards assistance that would need to be addressed through appropriate framing, information, and other interventions. So this would also be an important area, I think, for all of these programs to grapple with as they go forward.
Thank you, Shagato. I think we can go just a few minutes over our time. So Laura, if you can comment for about 1 minute, and then Mr. Gashigi, maybe you can share some examples of ways that you've been able to ensure that the cash transfers reach the most vulnerable. So Laura, please, just 1 minute.
I think Shagato covered some really important areas. There are no perfect targeting systems, and even even universal programs very much struggle with reaching some of the most marginalized, because it can be hard to reach the most vulnerable, even when you're looking to cover everyone. I think what's important is precisely to keep in mind that there's no one solution, and often some of the best solutions use a combination of methodologies. Traditionally, what's been done has been a combination of income proxies, often collected based on assets and education levels and other characteristics that are easily observable that are a proxy for poverty as measured in larger scale surveys. And often those proxy tests have been combined with community selection, community validation. And I think Mr. Gachigi, I'm sure he'll mention it, talked about these new approaches working across agencies and really with key informants. And I think the future also, there's a lot of possibility in the future of relying on other types of data. There's a lot going on in big data and analyzing cell phone records, satellite imagery, a lot of different approaches that are being used today that have a lot of potential, but where we also have to be very careful, because when you start collecting and using a lot of that data, there are privacy concerns, there are mistakes that can be made there as well. But I think this whole question of ensuring that we're reaching the most vulnerable and how to target appropriately when you need to target is evolving very, very rapidly, and definitely needs to be informed by an eye toward a behavioral lens and towards a respect for individuals and their privacy as well. Thank you.
Okay, so one of the lessons we have learned from the COVID is the need to have a database for the poor and the vulnerable. And towards this effect, the government of Kenya, with the support of development partner, that is World Bank, UNICEF, and the World Food Program, we are in the process of establishing a social registry. A social registry is a database whereby we'll have all the poor and vulnerable people within a single database. It's more or less like a small census, and you'll have the basic information and data about those people, and you cover the whole of the country. Once we have that database, it will now be used even for future emergencies or any other pandemic like this one to do some quick interventions. Because of what you need to do is go to the social registry, you mine that data, and then you design up specific interventions to support those people. And we are intending to be updating that data maybe after every 2 years so that we can see whether there are new changes which have come. The beauty of the social registry is that it will be easier now for us to do both the vertical and horizontal expansions in the case of a pandemic like this one. The other thing which we also needed to introduce, and the good thing is that we have already started with our normal beneficiaries together with Ideas 42, is to develop the culture of savings. Most of the people don't have the culture of saving, including those people in informal employment, those ones in the informal employment. And the COVID has really taught them a lot, because while some of them were declared redundant or they were told to go and stay at home, they depleted all their what they had. And then because of them, they used to live from hand to mouth. They found it very, very difficult. Some of them were even spending sleepless. They could go without food maybe for 1 or 2 days, simply because they did not have a savings. So we need to encourage our normal beneficiaries and other people to keep on savings, and if possible, even if you are not able to save in form of cash, maybe you can save in form of an asset, maybe in form of a goat, in form of a chicken, or any other asset, so that in case of an emergency, you can be able to dispose that asset, and then that way now you'll be able now to support your family. Then the other thing we have also learned from this COVID, and now to make us now to think ahead as now we are doing our programming for the cash transfer program, is that have got the new vulnerables who have come as a result of this one. Number one, we have got households with malnourished children, and they are quite a lot. And then we have got households with HIV cases. We have got households which are people who are chronically sick. But within our cash transfer programs, we don't target them. And they are really poor and they are really needed, they are really deserving. And then we have got child-headed households. These are whereby we have got a child who is 15 years or 12 years, but is the head of the household. Because the parents, they died 2 or 3 years ago because of HIV/AIDS or because of any other thing. That child is taking care of the other children, and they are also getting the support from neighbors or from other people. So we need to come up with a program on how can we address such type of category. And then we have got the hawkers, we have got the cash workers, we have got the domestic workers. Domestic workers were also equally hit by this pandemic, because when children were told to go home and parents also went home, they did not find the need to have the domestic workers. So the domestic workers were told to go home to their respective homes, and therefore they became redundant. And then there are those people who are coming on a daily basis maybe to do work. They used to come and do the washing of the clothes, the washing of the houses. Because of the COVID, they were told that we don't need enough visitors in our home. You might bring COVID to our children and so many other people. They also lost an opportunity which they were using now to earn some money. And then of course, we have got the casual laborers who are in the construction industry, in the roads building industry, and all those ones. Because when the pandemic came, most of those activities were stopped. So, and therefore they went home. So we need now to think on how maybe we are targeting our beneficiaries. And because the new vulnerables, they are equally poor, we need to come up with design programs so that we can caution them, not only during this time of the corona, but maybe in the future. Now the dilemma now we are having is this, that new vulnerables, we have put them on cash transfer. We are paying them on weekly basis, others we are paying them on monthly basis. We have now been paying them for the last 6 months. Now they are used to this money. After the COVID, what do we do with them? Because it was a short-term intervention, they are not within the system. We don't have a budget provision to continue with them even in the future. But the moment we stop that cash transfer we have been giving them on weekly basis, on monthly basis, they are going maybe to go back to the former situation of being poor and vulnerable. And we might, all the gains we have made, we might be able to lose them. So that's one of the policy dilemmas we are having. But as we move forward, maybe something good will come out of it. Thank you.
Thank you so much, Mr. Gashigi, and thank you everyone for joining us and for such a great discussion. We are unfortunately at time, but I hope that we can continue this conversation and keep this conversation going past this panel. So thanks again for joining us. Please make sure to answer the session survey that will appear after you close your session window, and I hope you all have a great day.
Thank you.
Thank you. Thank you.
Thanks, everyone.